Dr. Koop, AIDS testing is becoming as controversial as the disease itself. And you've spoken against compulsory testing because the unreliability of some tests, the fact that results can be used against those tested. As the disease toll and public apprehension increases, can you see yourself reversing your position?
Well, I am in favor of as much testing as we can possibly have. That's one of the best tools that a public health officer has in making projections. What I'm opposed to is compulsory testing, where because of the stigma of the disease, individuals lose many of their civil rights. And I just detest unfairness and unjustness, and that's what's happening to many people.
There's a lot of pressure at this time on your office, is there not? In fact, the administration, some members of Congress are pushing for mandatory testing. However, a bill was defeated this week, and will you actively oppose these attempts to impose mandatory testing?
Well, the Surgeon General can't actively do much of anything except bring to bear on any public issue moral suasion. I am a health officer. I have to act with honesty and integrity, and I have to call the shots as I see them because my mandate from Congress is to protect the health of the American people. And if I think we're spending money foolishly, if I think an action is not going to protect the health of the people, but especially if I think it's going to lead them into a false sense of security, I can't change my opinion. I will continue to speak out.
Projection on deaths from AIDS for the next few years are grim. In your opinion, how close are we to a breakthrough?
I think a breakthrough in the management of AIDS is way down the road. It's a very difficult virus that produces this disease. And of course, what we'd like more than anything is a vaccine to prevent it. It took 19 years to develop the virus for hepatitis B. It took 19 years from the discovery of the virus of hepatitis B to the point where we had an effective, generally available vaccine. And that was a comparatively easy virus. Now, to be sure, our methodology today is ever so much faster and more secure. But I do not see an effective vaccine generally available before the end of the century.
Can you foresee problems with the public? We're going to have an increasing number of deaths, and at some point might reach the panic period.
Well, there are two classes of people out there. There are people who are panicky, but they couldn't catch AIDS if they tried. And these people should be reassured that the lifestyle they lead will never bring them into a confrontation with AIDS. On the other hand, we're trying to reach people who either are unknowing or are practicing a high-risk behavior that could expose them to this virus. Now, in my report to the people, which I did last October at the request of the President, I said that this epidemic will impact upon everyone in America, and that is true. It will impact economically, and it will impact upon our delivery of health care. We look forward to having 54,000 deaths in the year 1991, and that's a very accurate estimate. If anything, it's low. Now, we have enough beds to handle the 3 hospital admissions that each of those patients will need that year, and the people who will die in 1992 have to be hospitalized, but we haven't got them in the right places. Those beds will be in high demand in San Francisco, Los Angeles, Chicago, New York, Newark, Miami, and we are going to have to find alternate methods of caring for this very debilitated population at the time of their terminal illness.
Speaking of San Francisco, there was a recent news article that education appears to be having some effect. It was reported this week that the number of AIDS cases reported from the gay community in San Francisco, one of the highest risk areas in the country, was drastically reduced, and this was attributed to the safe sex education.
I think that's probably true, but we even have better and quicker markers than that. People who are promiscuous of either sex, with either sexual orientation, have other sexually transmitted diseases, and these have much shorter incubation periods. And we know that when we beamed our first educational efforts toward the homosexual community, they listened to us. They did abandon the promiscuous lifestyle, and what we saw were diseases such as rectal gonorrhea just rapidly come down almost to zero. So we have known for several years that our message has been heard. It's just now being reflected in the number of AIDS cases.
There was also a news story this week that caused some apprehension, and that was the way AIDS can be acquired. And of course, the reports are that it's a sexually transmitted disease. However, there were 3 cases reported in the news media where health workers were contaminated by blood through the skin. And it wasn't made very clear that there were abrasions in the skin or there was some way for this virus to enter. One case, I believe, a woman, a nurse taking blood, the blood splattered in the mouth, but the others were not clear.
Those 3 cases, as far as we can tell, have been accurately reported. The thing for your listeners to remember is that if all 3 of those health workers had heeded the advice that the Public Health Service gave 2 years ago to health workers in managing blood and other problems associated with AIDS victims, none of them could possibly have been contaminated.
And that's to protect themselves.
Protect themselves with gloves, with masks, and so forth, in those hazardous situations. I mean, all of those people were doing very unusual things in reference to AIDS.
With all this attention to the AIDS problem, does this affect the function of your job and your...
There's no doubt about it. It affects the function of all people in public health, whether they're at the federal, the state, or the local level. It just is all-consuming. We still continue to do the other things we must do, however, but I do think that sometimes they get shortchanged.
And you have some other serious problems. For example, is there not an increase in tuberculosis cases and in some cases related to the AIDS problem?
Yes, there is. And you see, when a patient has AIDS, it's really a syndrome, the basic building block of which is a loss of the person's ability to fight infection. Their immune system is diminished and then destroyed. And tuberculosis is one of those diseases which can take hold if a person cannot bring his own defense mechanism to fight against it. So we are seeing tuberculosis now as one of the opportunistic infections that occurs in patients who have AIDS.
Is the press acting in a responsible manner? For example, a congressman recently died from AIDS, and he wanted it known. Other public figures do not want it known because of the stigma attached. What is your view on this?
I think the press in general has done a remarkable job of teaching the public. I think sometimes, all of us who work with the media know that the headlines don't reflect the story. I wish we could get a better headline writer for most of the AIDS stories because they're pretty sensational. But I really believe, sir, that until the average citizen in America knows that other people just like himself are dying of AIDS, we're going to have this stigma. And therefore, I think the more open this society can be about recognizing who died of what, the better off we'll be.
Some states we're getting back to compulsory testing for just a moment. Indianapolis now is, or Indiana, in the Indianapolis area in particular, they want to test prostitutes and known drug users and criminal offenders. What is your view of testing some of these people,
I think
immigrants and so forth?
Well, the Public Health Service already has put AIDS on the list of what used to be called loathsome diseases that can be transmitted. And how the Immigration and Naturalization Service will act on that advice is up to them. But I do think that people, criminals who have been incarcerated and are now being let out into society, I think they have to be tested, and I think indeed that their spouses should be informed about the status. Prostitutes certainly should be tested. And I'm in favor of any kind of testing that will contain the epidemic. Now, what I've just said will contain the epidemic, but just taking 2 people off the street and saying, look, we've got to test you, that's going to produce a stigma, but it's not going to contain the epidemic.
You know, in several of the documentaries that I have seen that have been done with AIDS patients, they continue, the promiscuous ones, the male and female prostitutes, continue their sexual contacts after they've been diagnosed as AIDS. Why is this? Shouldn't something be done with people?
Yes, there is, in every jurisdiction in all of our 50 states and territories, there are ways of dealing with these people. If anyone knows that he is the carrier of a contagious disease and continues to infect people either by not taking precautions or by deliberately setting out to do that, he can be separated from society either by public health laws which quarantine him or by criminal laws which would incarcerate him.
These are already on the books.
Yes, sir.
Mm-hmm. Now, getting to, well, let me ask you about cycles. We seem to go in cycles with these problems. We had diphtheria and World War, flu and diphtheria in World War I and before, and We've had polio epidemics. Now we're dealing with the AIDS virus. Is there anything?
I don't know that anybody can really answer that question for you, but I can tell you that the difference between this problem and the others you mentioned is that this is 100% fatal. We've never met anything that was 100% fatal without a cure and without a vaccine before. And that's what makes this such a disaster.
Turning to other matters, you mentioned the more than 50,000 deaths by the 1990s.
In that year alone, 54,000 in
54
19. There'll be 170,000 deaths by then.
By then, all right, all right. How about from alcoholism and smoking? What are the deaths from those?
Well, there are more people die of smoking every month than have been diagnosed totally with AIDS in the last 6 years. That puts it in a little perspective, but don't get encouraged about that, because before the end of the century, unless something happens, AIDS will surpass smoking as a cause of death.
Are we still subsidizing tobacco farmers?
We don't subsidize the farmers, but we support the prices of tobacco, and I can assure you that even if we stopped that tomorrow, it would not affect the health of Americans. In fact, I could paint you a scenario where it might be worse instead of better.
Are these laws banning smoking in public places having effect?
They certainly are. They're not only having effect on protecting the non-smoker from the passive smoke of the smoker, but they sort of force the smoker into reconsidering his position about quitting.
And this is one of your very strong
Well,
campaigns.
this is still the #1 public health problem in America as far as the number of deaths each year.
Thank you, sir.
Yes, sir.